Hello, students. A very good morning to all of you. In today's class, I'm going to discuss about different complications of pregnancy from the chapter Balanced Diet for Pregnant Women. So, here we will talk about pregnancy. Pregnancy is the most important phase in a woman's life, and it is a remarkable anabolic process where a baby is formed by accumulation of various substances from the mother's body like nutrients, blood, tissues, etc. And pregnancy induces profound changes in the mother. Also, it is a period from fertilization to birth, and there are tremendous physiological, psychological, and several other changes in the body. So, a well nourished woman begins her conception with reserves of several nutrients so that the needs of the growing fetus can be met without affecting her health. So, the gestational period lasts about 9 months or 280 days or 40 weeks or 3 trimesters. A normal delivery could be in between 38 to 42 weeks. When a baby is delivered before 37 weeks, the baby is known as preterm baby or premature baby. So, there are some remarkable physiological changes we can able to see during pregnancy. First, there is changes in the endocrine system or hormonal changes. Some placental hormones like human gonadotropin, human placental lactogen, and estrogen and progesterone are changing. And at the same time, the production of triiodothyronine and thyroxine are increased. Next, there is change in the metabolism as well. There is change in carbohydrate metabolism. Specifically, there is faulty glucose metabolism can also able to see, which is leading to gestational diabetes. Next, the changes in the gastrointestinal system. This is usually due to increased appetite, and nausea and vomiting can also able to see, which is known as morning sickness. And there is also difficulty in digestion and absorption. Next, there is changes in the cardiovascular system as well. The total WBC count is rises. Cardiac output is also rises, and there is increased blood flow to the gastrointestinal tract, skin, breast and kidney as well. Next, the change in the kidney functions. The glomerular filtration rate increases by about 50%, and there is glycosuria and proteinuria, which are common during pregnancy. Last changes in uterus. There is excessive cell division we can able to see in uterus, and placenta is formed during this period. So, a well balanced diet during pregnancy helps in the rapid growth of fetus, also helps in the development of placenta, enlargement of maternal tissues like uterus, breast, etc. Also helps in the formation of amniotic fluid and mineralization of skeletal and bone structure of the fetus, and for future it also reserves the storage in the mother's body as well. Now we are going to talk about some several complications which are common during pregnancy. First complication are toxemia and eclampsia. Toxemia and eclampsia both are high blood pressure related diseases which are observed after 20 weeks of pregnancy. And in this disease, the diastolic pressure is higher than 90 mmHg. The causes for toxemia and eclampsia are malnutrition and stress and anxiety. And the symptoms which can able to see during this diseases are edema, protein in urine or proteinuria, and high blood pressure. Next complication is the very well-known complication of pregnancy, which is anemia. Anemia is a condition in which blood does not have enough red blood cell and there is lack of hemoglobin in blood as well. The main cause of anemia during pregnancy is the diet is lack in iron, vitamin C, folic acid and vitamin B12. That is why the anemia is happening in pregnant women. And the symptoms of anemia are fatigue, dizziness, palpitation, brittle nail, hair loss and shortness of breath. Next are nausea and vomiting, which is commonly known as morning sickness also. And the causes of morning sickness is stress, anxiety, mental pressure. And the treatment for morning sickness is, in the morning, we should give high carbohydrate rich food like biscuit, puffed rice to the pregnant woman, and adequate amount of water should included with electrolyte and multivitamin tablet. Last complication of pregnancy is gestational diabetes. Gestational diabetes is diagnosed for the first time during pregnancy in mothers. Like other type of diabetes, gestational diabetes also affects the cell which use sugar and causes high blood sugar, that is affecting the pregnancy and also the health of the fetus. The symptoms of gestational diabetes are high blood sugar, feeling thirsty, being tired, having a dry mouth, and continuous urination. Students, I hope you have enjoyed the class. Thank you so much for attending.